Dwight Gilliland's home has grown quiet now that he's alone. His wife of 53 years lives in a long-term care facility in another town.
I wanted to get her back into Calgary, and now I'm waiting like 6 to 8 months.
The lengthy wait just one of a long list of problems plaguing Alberta's health system. It's why the Premier says it's time for a change.
The current Alberta healthcare system is one that has forgotten who should be at the centre of its existence: patients and the healthcare experts who look after them.
Healthcare was centralized under a massive superboard, Alberta Health Services, back in 2008. Ed Stelmach was the Premier.
I'm going to be very frank. The decision-making in this province in terms of budgets, infrastructure, and policy is made by government. It's made by elected people. And we drifted away from that.
The new system would see Alberta's government regain that control, with system delivery broken up into 4 parts. AHS will focus on acute care, with 3 additional bodies being created to oversee mental health services, primary care, and long-term continuing care.
I have concerns and my colleagues have concerns, and there's a lot of trepidation. The system's fragile right now. Any change that you do can cause, disruption, and sometimes even small changes can cause chaos.
The government says the restructuring is not about privatization or cutting costs, but over the last few months, Danielle Smith's UCP government has made plenty of waves.
It just seems that they want more control over it, to be able to control what happens, when and where it happens, and how it happens. And again, the last time I checked, the government isn't doctors.
The province says it will listen to healthcare workers and patients in engagement sessions over the winter, with plans to move ahead with the first phase of changes as early as this spring. Heather, Yourex-West, Global News, Calgary.